Welcome. RLE surgery, which is basically cataract surgery, is the safest and most effective surgery in all of medicine. It is performed 4 million times in America alone. For the last 10 years, we have had incredible advancements in intraocular lens technology that restore the abilities of the youthful human eye. The aim of this video is to provide education about the surgery and to help you decide if the surgery is right for you. It is important that you have a firm understanding of the risks and benefits. So if you have any questions about this video or about the consent form, please do not hesitate to reach out to us.
To begin, let's quickly learn a few structures in the human eye. The cornea is the frontmost part. It's clear and does 2/3 of the work focusing light. This is one of two places where we can correct vision, and it is here we can perform surgeries like LASIK. The iris sits behind the cornea and is an aperture that regulates the amount of light passing into the eye. It gets smaller in bright light and larger in dim light to allow us to see in the dark. Just behind the iris is the natural human lens. The young human lens is incredible. It can focus light from any distance by changing its shape. It becomes curvier when seeing up close and flatter for seeing farther away. In the center of the eye is the vitreous jelly. This clear substance is useful when we are children to guide the growth of the eye, but later in life it can break down and cause floaters, and on occasion it can tear the retina. Speaking of the retina, this is the film inside the camera. It sends the light signals to the brain, which interprets the images sent by the two eyes. To see well, light must be focused sharply on the retina. Our range of vision is the ability of the eye to see near and far away. This range peaks at childhood, and we slowly lose it over our lives until age 45, when glasses are part of everyday life for near, distance, or both. This is called presbyopia, and it is something all of humanity has in common. This occurs when the natural lens becomes stiff and unable to focus light. It will also discolor and lead to reduced image quality. Here we see the 50-year-old lens may not be able to focus light for distance, and even worse for near. At 75 years old, we can no longer see well, despite glasses, because the lens has become a visually significant cataract, blocking the light. It is inevitable that the lens be replaced with surgery at some point to preserve and stabilize vision. Once the natural lens has been replaced, the eye will not change significantly afterwards. The RLE or cataract surgery is often considered the final surgery. Alternatively, a temporary solution providing glasses independence at 50 or so is Monovision LASIK. This can correct your vision by way of having a distance viewing eye and a near viewing eye. However, this does not address the aging lens inside the eye, and in a few short years, the lens will yet again unfocus the light, resulting in the need for glasses. LASIK may also result in aberrations of the cornea that can reduce contrast sensitivity and produce halos. We see that the 40-year-old lens is very clear and evenly colored. No surgery is necessary here unless you are significantly farsighted. In general, RLE will outperform LASIK for farsighted patients at this early age. At 55 years old, the lens is yellow and rigid. RLE surgery will produce superior visual quality. At 75, there is a visually significant cataract that has formed. Now the surgery is called cataract surgery instead of RLE. Cataract vision loss is reversible with surgery at any stage. However, the healing time is exponentially longer as the cataract becomes more severe. A 90-year-old's cataract surgery may take several weeks to heal. After surgery, the eye will look like this, with a crystal clear intraocular lens that has significantly higher light transmission. Insurance does not cover all cataracts. it will cover surgery when the cataract has reached a certain stage, and this is termed a visually significant cataract. The criteria is usually 20/40 vision or worse in normal or bright lighting conditions. On average, American patients qualify for insurance at age 75. The criteria is different for different insurances and may be stricter as healthcare policy changes with time. RLE surgery can correct your vision earlier by 20 years or more, so you can enjoy freedom from glasses for everyday tasks now and for the rest of your life. Let's take a look at where and how the surgery is performed. You will be dilated and examined prior to surgery in the usual manner. Then we will provide you with a pill for relaxation. This is a typical surgery room where I operate, equipped with state-of-the-art surgical technology. The RLE or cataract surgery is simple to perform, and it is the safest surgery available in the world. It is gentle and painless. You are in a relaxed and dreamlike state during the surgery, but you are technically awake. There are few things I will need from you, so you can simply relax. The sedation is the reason for needing a driver to take you home after surgery. The surgery takes 5 to 10 minutes to perform. We perform both eyes on the same day, one after the other. In general, RLE surgery is even safer than cataract surgery, as we do not typically encounter complex situations since the patient is younger and the eye is robust. During your initial visit with us, we will be performing measurements of your eyes and your vision. This is to determine if you would be a suitable candidate for RLE surgery and which intraocular lens power is necessary to correct your vision. We will scan and measure your eyes in several ways to determine the dimensions of your eyes. This is called biometry. We will correct your vision for astigmatism and near or farsightedness. Astigmatism is the degree that your cornea deviates from being a perfect dome. Instead of the surface of a baseball, you may have more of a rugby ball shape. The rugby ball represents regular astigmatism, and this is corrected by using a toric intraocular lens to neutralize the astigmatism. You can expect us to correct your astigmatism during your surgery. Irregular astigmatism, to a significant degree, cannot be treated completely. The most common reason for irregular corneal astigmatism is dry eye. Dry eye can create wrinkles and pits in the surface of the cornea that alter the pathway of the light and generates blur. Some describe this as ghosting or doubling. While I cannot treat this, it may be possible for you to lessen the severity of these aberrations with diligence and time by using artificial tears and other recommended eye drops. Nearsightedness is also called myopia. It describes a patient's eye that can only focus on objects close to the face. Farsightedness, also called hyperopia, is a misnomer, and it does not mean you can see well in the distance. It just means you see worse at near. The degree to which your vision is out of focus or blurry is measured by a unit called diopter. Intraocular lenses that sharpen your vision are created in half diopter sizes. A small amount of correction, such as a half diopter, is typically unnoticed and insignificant, while 5 to 6 diopters of correction means you would be legally blind without glasses. Certain diseases of the retina, such as ERM, extraretinal membrane, macular hole, or macular degeneration, will cause distorted images. These are not correctable with RLE surgery, and RLE may not make sense in severe cases of retinal disorders. Another consideration is a very nearsighted patient who has a long eye greater than 26 millimeters in diameter. Patients with long eyes are at increased risk for retinal tears and detachments, with or without surgery. The long eye's retina is stretched thin in the periphery like a balloon that is inflated. The thin retina is structurally weaker and can tear spontaneously without preceding trauma. RLE surgery is very gentle and is performed safely away from the retina. As a general rule, If you experience constant flashes in the peripheral vision that do not go away with your eyes closed, or you suddenly see hundreds of new floaters, you must find a retina doctor emergently. Time is of the essence, and prompt diagnosis and repair by a retinal surgeon can save and preserve your vision. The retina surgeon is the only doctor who is qualified to help you in this situation. We will scan your retina prior to surgery to determine its health and let you know if there are special considerations for your eyes. There are a few scenarios where it would be very challenging to help our patient out of glasses. 1. Significant eye disease such as previously mentioned advanced macular degeneration or glaucoma and severe forms of dry eye. 2. The use of prism glasses, as we currently do not have prism intraocular lenses. 3. Severe forms of corneal disease that require you to wear hard contact lenses, such as in severe keratoconus. For those patients who have healthy eyes and who wish to have unsurpassed range of vision, then multifocal lenses are the way to go. 100% of patients with multifocal lenses will be independent of glasses for everyday tasks. Optically, light enters the eye from all distances and interacts with the multifocal lens, which parses and separates the light into distinct focusing elements, 1/3 to the near element, 1/3 to intermediate, and 1/3 to distance. The sorting of the light allows us to see well at all distances. In dim lighting conditions, such as candlelit dinners, your reading ability may become limited, and you may need to wear some reading glasses for the menu. A specific downside to the ring multifocal lens are rings at night. However, this issue has been minimized over the last 2 decades of lens optimization, and nowadays being bothered by rings is rare. This image demonstrates a rendition of rings as perceived with night driving. The ring multifocal lens may not be desirable for someone who spends a great deal of time in dim lighting or does a lot of night driving. Rarely are patients dissatisfied with their lens choice, but in the event you are unhappy and we agree that another lens may better fit you, then we exchange the lens for another one. But the wiser choice would be to give yourself time to adapt to this new way of seeing and trusting that your brain will eventually provide the rewiring necessary to successfully pair with the new lens. I strongly believe everyone will adapt well eventually.